Welcome to our channel Learn and Apply. We are continuing with part 3 of our tutorial series on conducting situation analysis, needs assessment and baseline studies. This is the third part of the tutorial in this series. If you haven't watched part 1 and 2, I would suggest watch part 1 and part 2. Part 1 and 2 covers the foundational concepts that will help you understand this part 3 better. You can find the link to part 1 and part 2 in the description below and here also. In the part 1, we discussed objectives, why these assessments are important, what is situation analysis, needs assessment and baseline, and examples from different sectors, key components of a need assessment, situation analysis or baseline, and the key steps to conduct situation analysis, needs assessment or a baseline study. Then in the second part, we started exploring each step in detail. We covered these steps in the second part. Step number 1, preparation and planning, defining the purpose, scope and objectives of the assessment. Step number 2, to gather background information, stakeholder consultation and review of secondary data. Step number 3, to develop assessment tools and methodology. And now in this third part, we will explore the remaining steps. Step number 4, to conduct data collection. Step number 5, data analysis and interpretation. And the last one, which is to compile findings, conclusions, recommendations, and develop a comprehensive report with quiz and reflection activities and additional resources. Don't forget to like, subscribe, and hit the bell icon for more tutorials. If you have any questions or need further assistance, leave a comment below. Here you can see the different steps we need to follow for these different types of studies. In the second part, we already discussed these initial 3 steps, which means that we have already defined our purpose, scopes and objectives. We have gathered background information, stakeholder consultation, and we have developed assessment tools and methodology. Now we will start this third part with step number 4, which is to conduct data collection. When you complete the tool developments and decide about the methodology, so now it's the time to go into the field and collect your data. Depending on the scope of your assessment, this will involve surveys, interviews, focus groups, or direct observations. Data collection is the backbone of your analysis. Whether you are conducting a survey in schools about attendance rates or conducting focus group discussion with teachers, how to collect this data determines the credibility of your findings. You will need to use a mix of quantitative and qualitative methods. Quantitative are those surveys or interviews, and qualitatives are in-depth interviews and focus group discussions. We need to use a mix of quantitative and qualitative methods to get a complete picture. Main activities in this step number 4 are fieldwork planning, data collection, and quality control. Let's discuss each activity briefly. Fieldwork planning: organize your fieldwork, logistics, team coordination, stakeholder engagement, deploy tools and apply validation checks, train data collectors and stakeholders, pre-testing of the tool, developing data collection plan, assigning roles to different team members for different roles, ensure necessary tools and resources are available for smooth field work execution. We will need to train data collectors on methods and tools. We will need to make sure that all data collectors are on the same page regarding each question of the tool. If different data collectors approach the questions of assessment tools in a different way, then you will have a biased data. After training of data collectors, we need to make a field plan to go to the field and collect the data depending on the scope of your assessment. This will involve surveys, interviews, focus groups, or direct observations. Second activity is then data collection. Use the developed tools to gather information from the target population. Implement your selected methodologies, surveys, interviews, FGDs, etc. And ensuring consistency in how data is gathered across different sectors or location. Quality control. Ensure the accuracy and reliability of your data through regular checks and supervision. You will need to regularly check the data which is coming from the field and provide relevant feedback to the team members. Continuously monitor data collection process. Verify data accuracy and address any inconsistencies or errors to maintain high quality data. If you want to learn how to collect data with online tools like Kobo, link of a complete playlist of video tutorials on online data collection is given in the description. Examples of these key activities in different sectors. For example, in education sectors, we will need to conduct surveys with students and teachers to gather quantitative data on school attendance and dropout rates. We will need to complement this with interviews to explore reasons behind these trends. For example, if we collect data on attendance and if that's very low, questions related to attendance, dropout rates, and our qualitative tools like interviews, in-depth interviews, focus group discussions. Why the attendance rates in a school or in an area is very low. So for that, you can collect information from teachers, students, parents, and head teachers. In a health sector, we need to use health facility assessment and household surveys to collect data on services availability and health outcome. We can conduct focus groups with mothers that can provide qualitative insights into barriers to accessing care. Similarly, in a wash sector, you need to gather data on water quality and sanitation coverage through surveys and field observation. You can use community meetings to discuss hygiene practices. Protection sector, you will need to conduct key informant interviews with local NGOs and government officials to understand risk and protection needs. Focus groups to gather insights from vulnerable population. Design a simple data collection plan. Choose a data collection method suitable for your sector and draft a brief plan on how you would implement it. Do share in the comments with us questions related to developing data collection plan or field plan. After collecting your data, the next step is then data analysis and interpretation. Key activities in this step number 5, data cleaning, to review the data for any inconsistencies or errors, blank information, outliers, etc. Data analysis, to use statistical or qualitative analysis methods to interpret the data, identifying trends, correlations, gaps, and key issues that needs to be addressed, including uncovering key insights and drawing conclusions that will inform your project design. And then comes triangulation. Cross-verify the findings by comparing data from different sources and methods like surveys, key informant interviews, focus group discussions, etc. to triangulate and validate your findings. We need to use data analysis techniques like thematic analysis for qualitative data, And similarly, statistic analysis for quantitative data using Excel or SPSS. Let's discuss these different data analysis techniques. Thematic analysis is a qualitative research method used to identify, analyze, and report pattern themes within qualitative data. It involves interpreting data to uncover underlying themes and meanings. Let's discuss an example. As I already mentioned that responses of qualitative data tools are mostly open-ended, so you will need to identify number one themes and number two codes. Suppose you conducted interviews or FGDs with parents, teachers, and students about the challenges in the education sector, and the responses you received are, for example, if one of respondent says that the school building is in poor condition and sometimes it is not safe. Respondent 2 says we don't have enough textbooks or other learning material. Respondent 3 says there are not enough teachers and sometimes classes are left without any supervision, and similarly respondent 4, etc. So here the first step for you is to identify themes from these responses. You can start identifying common themes or topic that multiple respondents have mentioned. For example, in this data, theme number one is infrastructure issues related to weak school building. Here you can see in this response. Similarly, theme number two is a resource shortage related to textbooks and learning material, which is evident from this respondent. And the third theme is staff shortage related to the lack of teachers. This is extracted from this third respondent. You would have data of a lot of respondents. This is just an example to identify relevant themes. Let's explore this a bit further. Here you can see all these three respondents, and here we identified themes. Once you have identified the themes, assign codes to segment of the responses. Codes are basically labels that you apply to pieces of text that correspond to the identified themes. For example, here you can see code for theme 1, infrastructure issues. So our code is weak building. Another code is related to resources, lack of learning material. And the third one is staff shortage, so teacher shortage. These codes will help you systematically organize the data, quantify how often certain themes are mentioned across multiple respondents. After coding, you can analyze the frequency of themes or go deeper into the specific issues raised in the interviews or FGD. For example, if most respondents mentioned teacher shortage, so this could indicate a priority issue for further investigation or action. For example, you are analyzing your data in an Excel sheet. So here the different statement of the respondents related to that questions. Here you are assigning themes and codes to that data. And when you complete this coding, so then you can analyze it as we do for quantitative data to obtain numbers and percentages related to these different types of issues mentioned by respondent. Techniques related to thematic analysis for qualitative data. Familiar yourself with the data. You will need to go through the data to become familiar with its content. Another technique is generating initial code. You will need to systematically code the data by identifying interesting features or segments. Assign labels, codes to relevant piece of data to categorize them. Another technique is to search for themes, group codes into broader themes that capture significant patterns. Combine related codes to form themes that reflect key aspects of the data. And another technique is to review themes. refine themes by checking if they accurately represent the data, ensure that themes are coherent and distinct, and revise if necessary. Then you will need to define and name those themes to convey its meaning. Create detailed description for each theme and give them meaningful names, as I mentioned in the example. Another technique is statistical analysis for quantitative data. Statistical analysis involves using mathematical techniques to summarize, interpret, and draw conclusions from quantitative data like attendance rates, health facility availability, resources related data, student teachers ratio, or in a health facilities population to health facilities ratios, etc. It includes various methods to handle and analyze numerical data. Let's explore these different methods. For example, descriptive statistic summarize the basic features of the data, measures of central tendency, mean, median, measures of dispersion like range, variance, standard deviation. Inferential statistics, predictions about a population based on a sample. Correlation analysis, assess the strength and direction of the relationship between two variables. For example, examine the relationship between a dependent variable and one or more independent variables, like age and different types of issues, gender and different types of issues. Similarly, tests the association between categorical variables. Compare means across multiple groups to assess if they are significantly different or not, like t-test and z-test, etc. If you want to learn data analysis, we have lots of tutorial. You can watch them. Links are given in the description for data analysis tutorial. Let's discuss examples of these key activities. For example, in education sector, we will need to analyze the data to identify key barriers to education such as lack of teachers or poor infrastructure, school enrollment, and dropout rates by genders and age to identify specific groups at risk. In a health sector, we will need to identify health services gaps such as areas with high disease prevalence but limited healthcare access. Examine maternal health services utilization rates and correlate them with maternal mortality data to identify service gaps. In a wash sector, we will need to determine the percentage of households without access to clean water and sanitation. Compare water quality data across different communities to identify areas with the most critical needs. In protection sector, we will need to analyze the safety concern expressed by women and children and identify the most vulnerable groups. We'll need to analyze reports of gender-based violence and map them against available protection services to identify underserved areas. To further improve your skills related to analyzing situation analysis data and finding baseline values, refer to the file in the folder. Link is in the description of the video. The fine name is examples for analyzing situation analysis data and finding baseline value to understand data analysis and interpretation. There is a file in the folder for which the link is given in the description. File situation analysis sample data. That is the Excel file. Download that file, practice basic analysis, and share in the comments what you could find. The final step when you complete the data analysis, then comes a reporting and dissemination. Finally, we need to prepare a comprehensive report that presents our findings and recommendation. Based on your analysis, you will need to develop clear findings and actionable recommendations. These should address the needs identified and guide the design and implementation of your product. And when we finalize the report, then we need to share that with different stakeholders. The key activities in this step are to identify gaps and prioritize needs and solutions, summarize the key issues and needs identified through the assessment, provide specific actionable suggestions for addressing these needs, rank the recommendations based on urgency, feasibility, and impact, and write a clear, concise, and well-structured report including an executive summary, methodology, findings, and recommendations. And then we need to prepare presentations or briefs to share with the key stakeholder. And then comes the dissemination. Findings should be compiled into a clear, actionable report. Because this report will guide the design of your project, we must ensure it addresses the most critical needs. Ensure clarity, use of visuals, and making actionable recommendations in the report. For example, if you are working on a report for education, so you will need to highlight areas with low literacy rates and high dropout, identifying districts with highest need for teacher training program. In health, we will need to point out regions with inadequate healthcare facilities and high disease prevalence. For example, prioritizing areas for the establishment of new maternal health clinics. In a WASH, identify communities with poor access to clean water and sanitation. For example, pinpointing villages that need immediate water purification system. In the protection sector, focus on vulnerable groups and areas with high protection risks. For example, targeting refugee camps for enhanced child protection services. Here are some examples for recommendation. In education sector, these could be your recommendation: building new schools, training teachers, and providing educational material. There could be recommended targeted interventions such as scholarship for girls or teacher training programs to address identified gaps. Similarly, in a health sector, our recommendation could be to suggest establishing mobile health clinics in underserved area and training local health workers, strengthening maternal health services in regions with high mortality rates based on the analysis. For a wash sector, we might recommend drilling new wells, construct latrines, and launch hygiene education campaigns. We might suggest focused investment in sanitation facilities and hygiene education in communities with poor water quality and sanitation coverage. Similarly, in the protection sector, advise on setting up safe spaces for women and children and training local protection staff. Advocating for the establishment of legal aid services in areas with high reports of gender-based violence and limited protection services. So these were some examples related to recommendation. Here are some examples related to developing action plans based on the areas identified in the recommendation. For example, for education sector, our action plan could be to create programs to improve teacher training, provide learning materials, and enhance school infrastructure. Similarly, in a health sector, plan interventions to improve healthcare access, train healthcare workers, and provide essential medical supplies. In a WASH, design projects to build water supply systems, improve sanitation facilities, and promote hygiene education. In protection, to develop strategies to strengthen child protection systems, provide psychosocial support, and raise awareness. Validation and dissemination. We first need to do a stakeholder review, share the draft report with stakeholder for feedback and validation, and then develop final report, incorporate the feedback and finalize the report and disseminate it to all relevant parties. If the situation analysis reveals that the major barrier to education is the lack of trained teacher, this should be prioritized in your project design. In a health project, if the analysis shows that maternal health services are lacking, so this should be a focus area in your project for that health sector. Here is a checklist for you. This checklist summarizes the steps in conducting successful studies, which you can use as a reference when conducting your own assessments. Here is that checklist. You can pause the video, and this checklist is available in the material folder, for which the link is given in the description. Situation analysis needs assessment or baselines are conducted to understand the current context, challenges, and opportunities before designing a project, and to understand the current states of a community or a sector or a project intervention. These assessment studies are basically part of the initial stage of a project management cycle, and they are crucial and very helpful for other stages like planning, execution, and closure. Conducting situation analysis needs assessment or baseline is essential for the success of projects. By following these steps, you can ensure that your project is grounded in a solid understanding of the context and needs, leading to more effective and impactful intervention. Applying the techniques that we discussed, you will be well equipped to design interventions that truly meet the needs of your target population. By following these steps, you will be well equipped to conduct situation analysis and needs assessment that inform effective project design. Remember, the key is to use a comprehensive approach to ensure all aspects of the community's needs are addressed. You must apply what you have learned by conducting a mini needs assessment in your community or organization using the tools and templates that we have provided in this tutorial series. Do share your experiences with us in the comments below. To ensure minimum and comprehensive length of the video, we divided the complete tutorial on how to conduct situation analysis needs assessment on baseline into 3 parts. If you haven't watched part 1 and 2 yet, I highly recommend doing so, because part 1 and 2 covers the foundational concepts that will help you understand this part 3 better. You can find the link to part 1 and 2 in the description below and here also. In the part 1, we discussed objectives, why these assessments are important, what is situation analysis, needs assessment and baseline, and examples from different sectors, key components of a need assessment, situation analysis or baseline, and the key steps to conduct situation analysis, needs assessment or a baseline study. Then in the second part, we started exploring each step in detail, along with practical examples for different sectors. We covered these steps in the second part. Step number 1, preparation and planning, defining the purpose, scope and objectives of the assessment. Step number 2, to gather background information, stakeholder consultation and review of secondary data. Step number 3, to develop assessment tools and methodology. And now in this third part, the remaining steps. Step number 4, to conduct data collection. Step number 5, data analysis and interpretation. And the last one, which is to compile findings, conclusions, recommendations and develop a comprehensive report with quiz and reflection activities and additional resources. Already uploaded a numerous video tutorial in this series, like this one, which was focused on monitoring, evaluation and research. The next one was only focused on monitoring and data. This one was focused on evaluation, and in this one we discussed result-based management. If you haven't watched these videos, links are given in the description. I hope this tutorial helped you conduct successful assessment studies. Thank you for watching. Don't forget to like, subscribe and hit the bell icon for more such tutorial. If you have any questions or need further assistance, leave a comment below. Feel free to leave any feedback or suggestions for topic that you would like us to cover in our future tutorial.